So key point is infected, like someone has to be, either the monkey or the human has to be infected.
Yes, with the virus.
Okay. So then, and for the case of humans, once you are infected, do you get the signs or the symptoms immediately, or when do you start experiencing them? And yeah, do you feel any change, or what usually happens? Can we just start with, do they have like an incubation period where once they get into your body, what do they do before you start noticing the signs and symptoms?
Okay, once you're bitten by the infected mosquitoes, the Aedes mosquitoes,
Okay.
the incubation period for you to show the symptoms is about 3 to 6 days.
Oh wow.
So within 3 to 6 days, you can feel the changes in your body. You can have headaches, the muscle pains. You can have vomiting, nausea, also fatigue. Yeah, those are the major symptoms, and fever. Fever is the first actually to appear. Sudden appearance of fever. Yeah.
How different is it then? And especially for the fever, because you see most of the time, I mean, sometimes we just get fevers here and there, and then we feel this is normal, it will go away on its own, and, you know, doesn't go. And in terms of then the degree, I would say, or the severity of the fever, how different is it from the ones, let's say, for instance, you get a common cold, you have aspects of fever, how different is it?
Okay, when we talk about yellow fever and the symptoms, the first symptoms to appear are the simple symptoms we've talked about, like headaches, fatigue. So those are the minor. Now, when we come to diagnosis of yellow fever, it's actually a little hard to identify in the early stages. Yes, the early stages.
It's more like mimics other conditions.
If you have fever, maybe you'll have something else. But mostly now, when you talk about history of travel, if you've traveled to areas of tropical areas or where there is yellow fever, now you can suspect to have a yellow fever infection. But in the later stages, it can be identified. Even in the early stages, for example, there is a test that is done called polymerase chain reaction. It can detect the yellow fever virus at early stages. But later there are the antibody tests that are done, especially the test we call ELISA, through blood test. So this is how you identify. Normally you take history. History will help you diagnose if you have traveled to
an area
that is infected by the yellow fever, for example, the tropical areas, and also the symptoms. Now you compare the symptoms, and also now the blood test can be done.
Oh, and we'll talk about diagnosis a little bit later in more in depth, because for instance, let's say someone has not traveled, but they come and you know the symptoms sort of, I mean, from the early onset, you can probably start to diagnose and see probably they have yellow fever, but this person has not traveled. Are there other ways that one can still get it? But in Kenya, do we see a lot of cases of yellow fever really?
Not really. When we talk about Kenya, it's not entirely endemic area where there is yellow fever, but there are other parts, like the Rift Valley. There are parts where you can find the Aedes mosquitoes, so you can get yellow fever. But in those areas, there are vaccines. But so Kenya is not an endemic area entirely, only some parts. But there are countries that almost the entire country, they have it's endemic in that area. So they get normally vaccinations.
Which ones are we looking at so that people know when they travel? Because I know, when you travel, you're always recommended get a yellow fever shot and all those things. But what are some of these countries that we're looking at?
Well, yellow fever is normally, it affects, like, for example, about 47 countries so far worldwide. So about 34 of them are in Africa, especially the tropical area like Congo. Democratic Republic of Congo, what I've talked about, the Guinea, Angola, those places are endemic. So they have, entirely they're endemic. So if you go there, you have to get vaccines. And also when we talk about those who are partly endemic, which is not like a requirement, for example, in Kenya, and also Sudan. Those are areas that only parts, there are parts
some
that,
parts of the country that are affected, not the entire part.
All right. And another, in America, there are also South America and Central America, other parts, which are entitled, about 13 countries, which have been labeled as areas with yellow fever infection. Yeah.
All right. Now, for the signs and symptoms, I mean, we talked about earlier onset of, some of the signs and symptoms where we talked about an aspect of headache. There's that part of fever and all those things, which this is some of the earlier signs and symptoms.
Yes.
Well, if it goes untreated or unattended to, can we talk about the later stages of the symptoms that maybe becomes a little bit like more of a warning, like something needs to be done as soon as possible?
Yes, mostly when you're infected with yellow fever, most of the people do not show the symptoms. They might not show, but most of them recover without treatment. But some may recover, but within 24 hours of feeling better from the earlier symptoms that we talked about, the simple ones. Somebody now can get now to the second level of infection, which is now the toxic phase. So in that phase now we have jaundice, because body systems are affected. Now there is a relapse of fever. Now fever comes in and other body systems are affected, especially the liver and the kidneys. So if they are affected, now when the liver and the kidneys are affected, now a person will have jaundice. Now the yellowing of the skin and the eyes because of the liver is affected. And also we can have the dark urine. Somebody can have dark urine. And also bleeding, now bleeding from the mouth, the nose, the eyes, and also the stomach. Now, from the name hemorrhagic, it's a hemorrhagic disease. So those are and also those people who go to the toxic phase, now the second phase, half of them might die out from the infection. Yeah.
Oh yeah, because at this point,
now the liver and the kidney, their liver and kidney failures. If there is no prompt treatment, the early identification and treatment, then a person can die from it.
And is this a matter of days or months in terms of then getting to that phase where if nothing is done, then the person can die?
Well, if a person can have the earlier symptoms, the simple symptoms like headache, fatigue, and nausea, vomiting, somebody can recover within 3 to 4 days. And after recovery, within 24 hours, now that person goes into the toxic phase. Now it's just a short period. So if you can feel better, like a day or a few hours, then now you go into the toxic phase, where now there is jaundice, you have severe
then what usually happens? Is it that the body tries to sort of fight the virus and then manages it a little bit? That is why someone feels better, but just let's say on the outside, but inside the virus is still either multiplying, and then that is where we get to the toxic phase.
Yes. The body tries to the immunity now fights the condition. That's why others get better without any treatment. But if it now affects the body systems, now it's now the toxic phase. If the liver is affected and the kidneys, normally in people who are immunosuppressed, they can easily get liver problems and the kidney problems because the immunity is not strong enough to fight the virus.
Wow, and we're talking about a matter of days, not even months, because we said like for the first 6 days, that is when you start noticing the symptoms. If nothing is done, within 7 to 10 days, someone might die. So this is like a very, very deadly, some sort of virus. So where does it settle? Does it settle in the liver, in the bloodstream? Where exactly does it settle?
It's a virus. If you're bitten, that means it's into the bloodstream. So into the bloodstream, the blood flows everywhere in the body. Mostly though, the liver and the kidneys are affected. Even the heart can be affected because the blood flow is through that. Elimination in the kidneys, it involves blood purification and all those things in the liver. That's why they are mostly the organs that are affected: the liver, the kidneys, and the heart.
And the heart might be affected. What about the brain? Does it can the virus find its way into the brain and?
Yeah, it can cause the nervous. It can affect the nervous system, where somebody can go into shock and paralysis.
All right. Then can we talk about the risk factors a little bit? That question of, let's say someone has not traveled. Are there people who are just at risk almost all the time of getting yellow fevers compared to the others?
Those who are at risk are the people living in the tropical areas. So that means everybody who is living in the tropical areas is at risk. And those who travel a lot. If you're traveling in countries, maybe you did not know that the country you're traveling to has yellow fever as an infection. But normally these prevented so much because of this. If you're going to a country, maybe they require you to have a yellow fever vaccination before then. So those who travel a lot, and now the people living in tropical areas are likely to, if you are in a place where you can be bitten by these Aedes mosquitoes, you are at risk.
You are at risk, whether infected or not. I mean, chances are
you are at risk.
You are at risk,
you can get bitten by the mosquitoes, and then you get the virus.
All right. Now you see the way. Okay, this is more on the prevention, but just I would need to ask this because I might forget. In terms of, you see the way some people, let's say they visit, the jungle, forest, and all those things, and then they have like mosquito repellents. Do they help? Let's say this person has not gotten a vaccination, and then the best thing they have at that moment is the mosquito repellent.
Yes, that's actually one of the preventive measures.
Okay, all right.
The most effective preventive measure is that you prevent being bitten by the mosquitoes. So if you have mosquito repellents, if they can't bite you, actually you won't get the virus.
Okay.
And normally, if you go to such places, it's advisable you get covered. The body is covered. You get long sleeved, long pants, so that you don't get the mosquito bites.
Okay. Yeah. What about the color? The color of the outfit that we wear, and I'm pretty sure you know about this, where they tell you need to wear more on the, is it on the darker, or the different shades of green or brown when you're visiting the jungle, because that does not attract the mosquitoes compared to the brightly colored clothes. Okay,
when we talk about mosquitoes and the bites, we in the different species, we find that the Anopheles mosquitoes normally bite at night, whether you have a bright
colored cloth or not. Okay, all right.
But with the Aedes mosquitoes, they normally bite during the day. So that means if they can see you well, normally they bite only during the day. So long as you are visible, they can see you, they can bite. Yeah.
Okay. So, all right. So then, in terms of the infection between the children and the adults, and I mean, we know sometimes most of the time the children are categorized in their, immunocompromised, because the immune system is still, developing, and the people of the older age, as well. So for them, once they are bitten, is the time frame then a little bit shorter as compared to someone who has a little bit of a better or stronger immune system?
Yeah, that's why the period is about 3 to 6. Some can appear earlier, and others, the symptoms can appear later on, depending on the immunity.
But is it different though, in terms of like between the children and the adults?
No, the infection is the same. You can be infected at the same rate, only that the symptoms can appear at different times.
Yes.
Yeah, the symptoms can appear at the 3rd day, some at 6 days, only in that range. Yeah.
Okay. So then the diagnosis, I know you mentioned a little bit. Can we then talk about the diagnosis in depth, like what usually happens? Because most of the time you'd find that people self-diagnose and they will say, oh, this is maybe homa, all right? Or this is something else. And then they go ahead and get either antibiotics and all those things. Do they make the situation worse, or does it help, self-diagnosis?
Okay, the problem with the self-diagnosis, you can be treating something that is not what is ailing you. So if you have fever and you treat yourself, maybe you're treating something that is not there. Now you will get, maybe you will get more at risk, now developing complications of that.
Okay.
Yeah, so that's why it's advisable if you have traveled. Normally, when you talk about diagnosis of yellow fever, it's majorly travel. If you travel to tropical, when you go to the hospital, they take your history of travel. They'll ask you where the places you've gone to. Now they'll check if those areas have yellow fever infection, and also the lab test. You test urine and blood mostly. Those are the tests that are done, and also the symptoms. So the symptoms together with the history of travel, and then the blood test can now lead you to the exact diagnosis.
Okay. Yeah. How long does it take? I mean, we hear cases of other diagnoses that might take a little bit of time. But for yellow fever, is it like an immediate diagnosis, or they have to take, and especially cases of taking blood samples, urine, and all those things? How long does it take?
Yeah, okay, you can diagnose immediately if you have the symptoms and the history of travel, now you can suspect yellow fever. But when it talks of lab tests, mostly in these countries like Kenya, maybe you won't have the test for yellow fever because it's not a disease that is common.
Yeah.
So normally the World Health Organization now advocates, they are trying to advocate for at least one national laboratory where yellow fever is being tested. So in that case where there is only one laboratory in a country, then you'll have to wait for the blood test results. So they will be taken there. And actually it's an emergency, so they'll do as fast as possible, even if it's in Nairobi and you are in another county. Because you are being told that one outbreak, if only one person is infected, that means it's an outbreak, and it's being treated with the immediate. It's looked at as an emergency because other people might get it,
and it's very I mean it's deadly. Within a very short period of time, one can die. Okay, so as one waits for the diagnosis, is there anything that is given to, I don't know whether it's slowed down, because like I said, the time frame is very, very short. I mean, between day 1 and day 10, one can die in between. So are there things that one can be given to sort of try and fight the virus as we wait for the diagnosis?
When we talk about the treatment of yellow fever, actually there is no specific antiviral drug that is given to treat yellow fever. It has no treatment. So mostly there is the supportive care. You treat the symptoms, what is there. So if somebody, mostly the treatment is about rehydration, because they normally suffer from dehydration due to diarrhea and all those things, and vomiting. So you give the oral rehydration therapy is given to this person for supportive management. If somebody has this kidney failure, liver failure, they are treated depending the specific care, depending on the symptoms. And also if somebody might have associated bacterial infections, now you treat with antibiotics. These are actually, even if you find the results, you still don't have the antiviral drug to give. So mostly treatment is supportive. You treat what is there.
Wait, is this on the toxic phase or whatever, as long as there's that aspect of where the doctor, let's say, thinks this could be yellow fever, or whether it's in the toxic phase, there's no treatment?
Okay, it's from the beginning. If you have the symptoms and the doctor suspects that you might have yellow fever, you'll still have, if you have the muscle aches and back aches, you'll still be given pain relievers. You be given pain relievers, you're given oral rehydration. If you are vomiting, you have diarrhea, you're given those things, and fever, you're being treated for fever as they confirm the diagnosis maybe. And also if you have any problem with the headaches, you're given also still the pain relievers.
We'll talk about the treatment a little bit later on, because now I am so in short, this thing is not cured. There's no treatment for the same. Once you get it, that's it. The best you can do.
It's supportive
get
management.
The supportive
care in the hospital. Actually, if you have, when we talked about the symptoms, we say that others may not have symptoms. Others have just not severe headaches. They can get well without any treatment. So it depends with the severity. If you have severe infection, like if you now have jaundice, you have dark urine, you have excessive fever, you will have to be admitted and be supported in the hospital. So they will be treating whatever they see.